Welcome back. This is Dr. Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Let's talk about cheek implants and why I really hate cheek implants. And what brought this to light to me recently was, the Johnny Depp Amber Heard trial. Whenever I saw the highlights of each of the day's trials, I kept seeing Amber Heard's incredibly asymmetric and displaced cheek implants. They stood out like a sore thumb. And it just reminded me time and time again of why cheek implants really are not to be used in most cases. In fact, they look very asymmetric in most cases, very unnatural, and they don't age well. First of all, in the anatomy of the cheek, to place an implant right on the malar eminence really is not anatomically sound, and also it doesn't age well with you. I see so many patients almost weekly that have had cheek implants, and when they age, they look almost like a chipmunk. So don't do them. And you could see in Amber Heard when she would talk and animate, they didn't move, they were just like stuck onto the cheek and they just protruded outward, especially when she would animate. And that really is unnatural. And she's actually a very beautiful woman, but that really has distracted from her appearance. And of course, she's had other things done as well, including a rhinoplasty and other things. But the cheek implants are really something I want to discuss because in most cases, they just do not look good. The only implant that really looks good in the face is the chin implant, and that's the subject of another YouTube. The chin implant is, if well placed, works well. But to put a cheek implant either intraorally or through the lower eyelid does not look good, both short and long term. And the real problem is long term, if you try and replace them, there's been enough bone erosion there that it's very challenging to do so. So there are many other alternatives today, including facial fat augmentation, which is really the best way to do that. You can add your own fat where you've lost it. And I describe that in the science of aging. So you can add fat in that area. You can see that in the science of aging where you can correct it and then it'll age with you. You're replacing like with like. And of course you can use fillers, higher density fillers, like Restylane, or you can use Voluma, or you can use a variety of other fillers, hyaluronic acid, biodegradable fillers that really work well for 6 or 12 months. And fat obviously lasts a lot longer. So I think the most important thing when you start aging, the cheeks are one part that ages, but it's your eyes and other things that ages far more rapidly. So you should correct that before you go and attack or put your attention into the cheeks. And that's why Amber Heard looks different. She looks sometimes totally abnormal, and it really detracts from her overall appearance. So why I hate cheek implants: number one, they don't age well. Number two, they make people look very different and funny. And number three, they have potential risks and complications, including infection, bleeding, bone erosion. And number four is when you try and replace them as people age, it's very challenging to do so. So in summary, I would say, if you have cheek aging, look at your face. You may need other things done, like fillers of the face and the nasolabial folds or the cheeks, or a chin implant. And use fat or use a hyaluronic acid filler like we discussed. There are other great alternatives. And then eventually, of course, a lift and fill facelift, a true facelift, is in order in patients that are in the late 40s, early 50s. But you shouldn't use a Band-Aid to try and fix early facial aging, especially in the cheek area. So know before you go. And always consult with a facial aging expert, a board-certified plastic surgeon or a facial plastic surgeon that has expertise in understanding the art and science of aging of the human face, so that people don't look different. We as plastic surgeons, as board-certified plastic surgeons, are in the face protection, not witness protection program. So we want to make our patients look as good as they can be, and that is not a good reflection when you see Amber Heard's really displaced cheek implants. So like and subscribe to my YouTube videos. My goal is always to make you a better you. Enjoy.